All right, Rhett, try this again. I apologize. We had a little bit of difficulty uh, going off there. So listen, welcome to Phlebotomy Solutions and Victor Valley Phlebotomy questions and answers, where I'm going to answer some most common email questions I get. Also here on YouTube as well as personal emails regarding phlebotomy. So if you have a question and we have a comment, put them right here in the side chat. We'll be glad to get to them. I'll be trying to get as much as we can today, but I do have a list I like to read from because these are the most common ones that I do get from people right here. Um, and so, what we're going to do is we're going to talk about phlebotomy. Again, answering the basic questions that you might have in phlebotomy, and if you do, leave them here. I'll be glad to try and answer some of them for you, as well as going through this list. If you're new to the channel, please like, subscribe, share, leave a comment here. But we're going to try and get through this today with a lot of questions that I've been getting most common. Now, if you don't know me, my name is Al Garza with Victor Valley Phlebotomy Training and Phlebotomy Solutions. I have 20 years experience in phlebotomy, both working in the field, creating and building phlebotomy schools, working in labs. I mean, building curriculums. I have my own phlebotomy school in California. Actually, I have two. I have one in Victorville and one in Rancho Cucamonga. So I do have a lot of experience in a number of areas of phlebotomy. So basic understanding of phlebotomy is this. Basically, phlebotomy is basically drawing blood on patients in order to get a medical diagnosis so that the doctor can treat the patient. You're just drawing blood from a patient properly so that the doctor that you could take it to the lab, get it processed, get it tested, and then of course the physician will have his results that they need to treat the patient. Um, One question I get is, what is the qualifications? Do you need to become a phlebotomist? Well, to become a phlebotomist, you typically need a high school diploma or a GED, something equivalent, and basically passing a national exam, usually through one of the different test agencies. But that's all the requirements that's needed. You don't need any special other degrees. You don't need science degrees. High school diploma or something equivalent like a GED is all you need to become a phlebotomist. Okay, so that's all you really need. Now, so that's a common question. Uh, Another common question is, how long does it take to become a certified phlebotomist? I get that a lot, and that depends on which state you're in, what the regulations are. In California, Department of Public Health requires 40 hours of didactic in-class teaching. You can incorporate skills there. Then you have to have another 40 hours in the field at a hospital or lab drawing on live patients. Typically, you need 50 successful blood draws. They also have skin punctures, I think it's 10, and observing 2 arterial blood gases. So every state's different. Some states don't require clinicals or externship at a hospital. So whatever state you're in, you have to kind of look. So it could take anywhere from 8 weeks, 6 weeks. It could take longer depending on how long the program is with the hours. So that's one question I get, and that's dependent on every single state. Let's see. What skills are essential for phlebotomists? Important skills include hand and eye coordination, attention to detail, the ability to handle stress, which is important because when you're working in a hospital, you're working in the ER, you can transfer to labor and delivery. And I've been in when I worked in the hospital, it was very fast paced. We were constantly going around to different departments. I was bouncing into ER, dealing with, critical patients who were just brought in, and we have to draw, and they're doing CPR or trying to start a line on them, and I got to get blood. So I got people hanging all over me. A doctor is ordering this, this, and this. So ER is a very fast pace in hospital. ICU, um, very stressful. Labor delivery, having to draw on not only on the mothers but also pediatrics, drawing on babies. So it takes a lot. You have to be able to handle a lot of stress. Okay, that's critical. Excellent communication skills, being able to talk to the patients. This isn't essential for a phlebotomist, I believe personally, is being able to communicate and talk to a patient. You don't know when you have patients that just don't want to have a blood drawn. I walked into a room one time. I was sent to a room because the patient denied the phlebotomist. They didn't want to have their blood drawn anymore. So I went in there and I actually had to talk to the patient, kind of ask questions about what he was afraid of. And finally, after about a good 15 or 20 minutes, I was able to convince the patient to let me draw. So having good communication skills with the patient, being able to overcome their fears is very important in phlebotomy. And I think that's something that if you're doing an interview for phlebotomists, then you need to put that as a strength. If you're a good communicator, you got to put that as a strength, that you're good communications, you handle patients well. Very important skill. Also, compassion, attitude towards patient. Again, being able to relate to the patient, understanding their fears. Even with children, when you're dealing with younger children, you have to be able to help overcome those fears. Okay, is phlebotomy a good career choice? I would say definitely it is. In this field of growing within phlebotomy, you can definitely move up in phlebotomy. If you don't just want to work in phlebotomy, there's different opportunities. I know people who've gone from phlebotomy to respiratory therapy, becoming a nurse, and some of the hospitals even paid for their education, believe it or not. So having a good phlebotomy job in the field, you can go into supervisors, managers positions, working in the field. You know, again, continuing education within hospitals and labs. Again, you can move around in the hospital. You can go for a laboratory tech, a laboratory technician, phlebotomy technician. It's a great way to see inside the medical field without breaking the bank. Okay, because it's not as expensive, let's say, as medical assisting. Medical assistants, you have to pay thousands and thousands of dollars, even tens of thousands in some cases, where phlebotomy for either 2,000 or more, between 2 and 3,000. Ours is a lot less, but roughly between 2 and 3,000, you become a certified phlebotomy technician, working in the field for maybe 20 plus dollars an hour, 25 depending on your area. So these are all, it's a good choice if you really look to get in the medical field without going into debt. Okay, it's a really good choice. Another typical question I get is, what are the duties of a phlebotomist? Typically, of course, drawing blood on patients, being able to process and label samples, maintaining equipment. We have to maintain our equipment that we use, centrifuges and all that. Entering patient information into databases, computer literate, which a lot of times they do train you in phlebotomy. But again, you have to be able to know how to operate and use a computer and be trainable to be able to do so, especially with certain software. Let's see. Also, with that, you have great thing is ensuring patient comfort and safety. Be able to work with the patients, dealing with people on a regular basis. That's important. So, typical duties again. Every field is different in phlebotomy, depending where you work. But a lot of it's drawing blood, maintaining equipment, dealing with patients, doing database information, transporting blood, being able to moving blood from different tubes and handling urine, different specimens in phlebotomy. It's not just blood sometimes. So even handling different specimens. So you have to be aware of that. Let me see what we got here real quick here. Again, if you have any questions, try to put them here. I'll try to get to them. Uh, First time using this, so let's see if I can put some stuff out here. Let's see here. Any questions you might have, definitely put them here. All right. And then I'm gonna answer a couple more questions here because I do get a lot of questions, and you know, I think mainly with people, we get a lot of that here. Let me just. All right, let me see here. I do have a question. What is the difference between the red tube and the tiger tube? Okay, so let me make this point here. Your tubes are going to vary depending upon red tubes typically have no additives, and of course don't have anything in them. A lot of times they're just it'll just and you have to be able to read the label on the tube and see. And then it says tiger tube is sometimes what we call, it's like the red and black on top. The anti it's is basically to clot the blood. It's a serum separator tube. A lot of times an SST or PST, plasma or serum separator. So every tube is different. You just got to look at the side of the tube, the label, and see. But a lot of times, like I said, the red is usually typically no non-additive. Again, just read the side of the label of the tube. And again, I think the pay rate, I think I discussed that a little bit about the $20 plus, depending on where you live. So let me see here. Another question I get, see, what type of equipment is used in phlebotomy is mainly a question I get. Remember using different types of needles, different gauges of needles. A lot of times we have, and here's the thing with this, I think this is important. You have to be able to determine the gauge of the needle you're using with the size of the tube. This is something I find a lot of phlebotomists, at least new phlebotomists, the mistakes made is being able to determine uh, the tube size with the proper gauge needle. I think that's important because if you're dealing with patients with very fragile veins, even with or even with infants or children at a certain age, or geriatric patients, the older patients, if you're using a larger gauge needle like a 21, you say, well, I'm going to use a 23 gauge needle, butterfly. Okay, but you're using a larger tube uh, rather than a small pediatric tube, something that might be that doesn't have a lot of vacuum suction in it. If you use the larger tube with that gauge, you can you'll still blow the vein, or you can cause the blood vessels to break and ruin the sample. So you have to determine the type of vein you're going for and match the needle with the tubes. You don't use, just like you don't use a large gauge needle with small tubes, and you don't use a small gauge needle with large tubes. You have to be able to make a distinction of saying, if I'm using a 23 gauge butterfly, then I'm going to use the smaller tubes so it works good with the blood flow. Just like 21 gauge needles with larger tubes to get a better blood flow. You don't want to blow a vein. So make sure that you are using proper gauge needles with proper tube size. And again, you're using, your tourniquets. Make sure you're always asking your patients if they have any allergies or allergic reactions to specific types of tourniquets. Some tourniquets have latex. Well, all tourniquets have some form of latex on it, so you have to be careful. And if you do have that patient, you have to create a barrier to try to put the tourniquet over, whether it's a shirt or something over it. So be careful with latex tourniquets as well. Okay, you're using all kinds of different equipment, alcohol swabs, different gauzes, butterfly needles, all those things. Know your needles, know your gauges, and know your tubes, and know your equipment. Okay, that's what you're going to be using all the time. All right, so make sure that you're able to make distinctions on what type of needles and what types of tubes. All right. Also, I get a question about the order of draw. I'm going to direct you guys to our order of draw video that we have, which would help you be able to, learn the order of draw properly. That's important. So again, look at our video. Let's see, I have another question here. What would cause slow venous flow in the middle of a draw? Good question. Uh, that could happen. What would cause a slow venous flow in the middle of a draw? Oof. We have a video on that for difficult draws, things that could happen. Uh, the vacuum of the tube can go out. That's one thing. Your needle placement it might have came out or might have shifted. Um, typically, it's typical things with blood flow is that either the tube of the vacuum, the tube stopped, and you need to just take the tube out and get a new tube. The needle might have moved out of the vein. Something with what you did, maybe the patient moved. Maybe the needle placement wasn't all the way in, so blood flow started but then stopped. Number of factors can happen with that you want to be careful of. So every case is different. I've seen a number of different reasons why. A lot of it's needle placement or something's wrong with the tube. So, or sometimes if you release a tourniquet too soon, that can stop blood flow because the tourniquet could be helping you with restricting blood a little bit. And then once you pop it off and the vein relaxes, the needle might come out, and then you've got no more blood flow. That's why I always tell my students, leave the tourniquet on up to the 1 minute. So, and if you're going to go past the 1 minute, then you can release the tourniquet. Because if you're in the vein and you release that tourniquet too soon, if that tourniquet is helping the vein stay in the needle, distended up with the tourniquet, it's going to relax the vein, come out, and then you got stop blood flow. So tourniquet placement could be also an issue with that. So tubes, tourniquet placement, needle placement, um, that could be a factor. How many questions will be in the final exam? Typically 146 questions, depending on what test agency you're doing. It's all multiple choice and timed, usually 3 hours. Different testing agencies, that's typically the standard. But again, you might have a little more, a little less, depending on where you're going. In your experience, what are the most common reasons why phlebotomists may miss the vein? What are the most important things for new phlebotomists to focus on improving? Great question. It's another one I get a lot of. Most common reason why phlebotomists may miss the vein. Typically, a lot of times when a new phlebotomist is palpating, they feel a vein, they don't realize the depth of the vein or the width of the vein, so they may not go in far enough. They might just go short because they're not determining the depth. If you have a very large arm and you have to push down hard to feel the vein, and I have a video with locating difficult veins, you might have to put the needle a little bit further in. So sometimes it's needle, 99% of the time it's needle placement that they're missing, why they're missing. So that's really the most common thing that happens. And what are the most important things for new phlebotomists to focus on improving? For me personally, what I've seen with my students, the most important thing they need to be improving on is their draw skills, practicing, getting a plastic arm, working on their, their tying the tourniquet properly, putting the needle in, knowing what they're doing, the angle of insertion, what angle they should be drawing in. If you can ask a phlebotomist, what angle do you insert the needle, and they can't tell you, then there's one problem. If I ask them, what is the primary vein you're going for? They should be able to tell you between the median cubital, the cephalic, and the basilic vein. If they don't know, that's the other problem, because if they just go for whatever vein they think is the best, that they might hit a nerve or cause damage. So knowing anatomically what veins you're going for, the angle of insertion, the anatomy of the arm, the back of the hand, practice your skills, improving your draw skills, because that's all you do. You're a phlebotomist. All you're doing is drawing blood. So you need to focus on honing in on your skills. Drawing pediatric patients is not the same as drawing adult patients. Okay, it's a totally different thing. So you have to learn, to draw like pediatric patients, geriatric patients, which is in more of the elderly, or over 65 or 60 and up. You have to learn how there's different ways of drawing, different types of tourniquets, different types of tubes, needles, all those things for different. So you have to be able to learn. Now, for me personally, honestly, when I worked in the hospital, I think that's where I got my overall experience. If you can work in a hospital for at least a year, you will really sharpen your skills, because you will learn how to draw on pediatric patients, geriatric patients, ER, all the different departments in a hospital. You're going to learn within that first year what it takes to be a phlebotomist. I know people don't like working in a hospital, and I always tell them that's where you get your bulk of your training is in a hospital. And if you can do that, oh, you can go anywhere. You can go to LabCorp, you can go to independent lab, you can do anywhere else, because you've worked in such an intense environment, and your skills should have been really honed in at that point. So definitely work in a hospital if you can for at least a year, if you really want to get really good experience. And Will, thank you for saying that, for the work we've done. Any tips for locating difficult veins? Yes, in fact, I created a whole video of that. You can scroll down to our YouTube channel. If you haven't subscribed, do so. I have tips on locating difficult veins, which is how to utilize the arm, bend the elbow, turn the wrist while you're palpating, and direction of the palpation on your arm, how to turn your finger. You want to locate the depth of the vein, the size of the vein, the width of the vein. You want to be able to feel all those things. So again, depending on your skill level, I teach my students, and this is why I made a video on this, is again palpating the vein, rotating the wrist and arm, bending the elbow while you're palpating. That way you can rotate the finger for the depth of the vein, All those things you want to be able to train yourself in so that you can locate difficult veins. And honestly, it just comes with experience. The longer you do phlebotomy, the more proficient you're going to be in it with locating difficult veins, especially specifically with pediatric patients, which they have smaller veins. You have to use a smaller needle, and you have to be very careful. So you really have to know where the veins are. And again, some of the most common, again, order of draw stuff. Again, I made videos on order of draw. Of course, you can start with blood cultures and work your way down. But again, I have videos on this. And you're welcome, Jazzy Mama, and welcome, Jazzy V. I made videos on this. Please go to the videos and look at the videos on those because that helps with this channel. This channel is supported by you guys, the viewers. All right, we want to thank you as we're approaching, close to 100,000. This channel is supported by you guys, and we appreciate all your views. So some of these questions, I would redirect you to a video because we've done it, and it helps again with our, monetization to help grow the channel, so I can do more things for you guys. So another question I get is, how do you ensure the accuracy of a blood sample? And basically the answer is ensuring accuracy involves following strict procedures for sample collections, labeling, and handling, as well as double checking patient information and maintaining a sterile environment. So following protocol is very important to ensure accuracy of blood samples. One thing, when you have a sample that gets rejected, typically it's something the phlebotomist did wrong. Whether it's they didn't invert the tubes correctly, maybe they didn't mix the additive with the blood correctly, so the anticoagulant didn't work. That can reject. They left the tourniquet on for too long, over a minute, which can cause the hemoconcentration of the blood, which can then cause the blood sample to get rejected. The tourniquet was on too tight, again, can cause hemoconcentration. So these are factors you have to be careful in when you're to ensure your blood samples are accurate and they don't get rejected. Here's what happens. If you get a rejected sample, then this patient has to come back and get drawing it. So if they're going into surgery or they're looking, they have something scheduled coming up for medication, treatment, now they have to wait longer for those results because they have to come in and get redrawn. And anything could happen during that time. A patient's life can be on the line while they're waiting to come and get redrawn because it wasn't done correctly the first time. So as long as you follow the proper steps and protocols, a lot of these steps were covered in a lot of our videos, then that helps you creating any errors, just like the order of draw. I don't know how many of you know this, but if you do not follow the order of draw, even though it's a rare occasion, the patient's life can be at stake. Give you an example. If you're using between a green and a lavender top tube, so if you're using heparin or EDTA, the lavender has the EDTA, and of course the green has a heparin. EDTA contains higher potassium. So let's say you drew the lavender first. You're supposed to draw the green and then the lavender, and you reversed it. If you had any kind of carryover between the tubes of the additive while you're drawing, and some of that potassium carried over into the heparin, and that patient was getting drawn for levels of potassium, that could alter the test results for the potassium. And if they're on any kind of special medication, that can be a problem. Maybe they're on medication for potassium or something, and then the doctor says, "Oh, your potassium is too high now. It's weird. Let's reduce your medication." But the phlebotomist didn't follow the order of draw, so that potassium carried over from the EDTA into the heparin, skewed the results, and now the patient gets the medication decreased or off, and then that patient can die. It's rare, but it could happen. And this is why you follow the order of draw, because the additives will go from the lowest to the highest, and they have to follow the order of draw. Patients' test results can depend upon the order of draw. So please follow the order of draw. Don't go outside. There's a reason for the order of draw, we tell people. So follow it. That's very, very important. So other questions that we get. Let me see here. We do get some other ones. Again, I get a question about how to deal with difficult veins. Again, I know it's in the chat, but again, watch our videos on handling difficult veins. But Some things you might want to include in here is using smaller needle, the proper gauge needle. Typically, it's 23 now. Employing a tourniquet properly, making sure that the tourniquet is on properly to help the vein distend up, so that you can actually feel the vein and get and actually draw on that vein. You might want to use. Some people like to use warming the area with a warming pad that could help. And then some people like to use those vein finders. If the hospital allows you to use a vein finder, then by all means, use a vein finder. Um, but don't rely on these things. Most of this stuff has to go with experienced phlebotomists knowing how to feel for the vein. Excuse me. The more experience you get, the more time you get put in the hospital and labs drawing, you'll be able to locate veins with your eyes closed. You could turn off the lights in a room, dead an arm, and you should be able to feel a vein and be able to draw. And basically understanding anatomically where the veins. You have the M-shaped veins and the H-shaped veins. And like my shirt here, I have on here has like the H shape, what you'll see here, the H shape and the M shape. Okay, so we have the M and the H-shaped vein. These are typical veins, how they look in an arm. If you know these veins anatomically, then you should be able to locate veins. So knowing anatomically where the veins are, what you should be feeling for, again, feel for the buoyancy, the bounciness of the veins. Do not, if you have a vein that's hard, feels like a string or something, do not draw. You're probably looking at it, feeling a tendon or maybe a vein that's sclerosis, hardened up. Do not draw in hard veins. Any damage to the site, do not draw on that. If they got burn marks or scarring, do not draw. You need to find another location, the back of the hand or another vein. Look for the cephalic vein, the back of the hand, dorsal metacarpal veins in the back of the hand. The basilic vein should be your last vein because it runs next to the artery in the arm, the brachial artery, and you have more nerves that run along that. So you don't want to hit a nerve or nick an artery, which happens quite a bit when you're doing phlebotomy. So look for the median cubital, cephalic, back of the hands. Last thing you should be looking for is the basilic, which is the inner part, right in the inner part of the arm. Okay, because you have the brachial artery and a lot of nerves. All right, so consider those things. Let's see. How do you stay updated with the latest phlebotomy? This is something that I get because I try to subscribe to a lot of different websites for phlebotomy. So look for different websites. CLSI has a website, or CLSI. Look at the HIPAA guidelines, OSHA guidelines, phlebotomy education. Follow what changed, because a lot of times phlebotomy procedures do change. Give you an example. We were told up a year and a half ago, 2 years ago, to do circular motions with the alcohol prep pad from the center out. And then it changed now to just rubbing back and forth, the friction motion with the alcohol pad. Now that changed 2 years ago. So a lot of my videos, you might see the circular versus the friction. Now, I don't have to agree with it or disagree with it. Either one's fine. You just got to follow the guidelines. Now, I looked up as to why that was a change, and there was no studies on it. It was just assumed or speculated that the friction might be best for, I don't know, no real reason. They didn't really give a reason when I looked up the actual article. It was just something they just transitioned and thought that might be a better way to prep the area. So the circular motion versus the friction motion, there's no reason why one is better than the other. There's no study on it, no real study on it. It was just kind of thinking like one might be better off than the other with no real evidence as to why. So, but you got to keep up with that because those are things that change within phlebotomy. So you're not doing centric circles anymore. You have to do now friction. So stay updated with phlebotomies. Try to get to websites that do that. Now, another question: what is the most rewarding part of being a phlebotomist? A lot of people love helping and dealing with patients, contributing to their diagnosis, helping them find out what's wrong with them, being a part of a healthcare team, and of course, making a difference with people. I know a lot of phlebotomists enjoy their job because patients who have a good relationship with phlebotomists will always come in and say, "Hey, so and so working here. They did it. They did a really great job on me. I really don't want anybody else to draw my blood." So you're building that rapport, you're building that reputation in the community, and people, look at you like someone who can get the job done, and that's a good feeling that you do your job so well that people will actually, come and come want you specifically and ask for you by name. So again, there's a lot to it. I mean, I think there's a lot of great rewards to being a phlebotomist. So dealing with patients, being a healthcare team, a good profession, it could be a good job. Some people, I know people who've doing it all their lives, over 30 years as a phlebotomist, just drawing blood. That's what they love to do. So it varies for everybody. And the reward can be different areas of phlebotomy. So find why you love it and then do it. Okay. So let me see if I have any other questions. If you have any more questions, leave them here. Um, those are some of the the more common questions. There's one: are there any risks associated with phlebotomy? As any other medical field, of course there is. Uh, you know, General safety risk includes you could possibly get a needle stick, accidental needle stick, especially after you draw a patient. That's a risk. Infections in the hospital, dealing with patients who have specific illnesses, TB, to other in isolation rooms you got to deal with that you have to go through. Fainting patients that fall over. Um, Proper training will help you get through this. You really need to be properly trained in your school about how to handle difficult patients and weigh the risks of working with patients in a hospital lab. Okay, again, like any field in the medical field in the hospital, there's risks to everything. So you have to outweigh them. Okay. So just keep that in mind. Let me see here. Anything else with questions? Let me see here. I had some great questions in here. If anybody else has any questions, put them in here. If not, I might go ahead and call it. Hopefully, everybody can hear me okay. Can anybody respond if they can hear me pretty well in here? Is anybody having difficulty hearing me? Uh, can I get anybody in here with that? Anybody? Let me see here. We get a lot of great. Yes, I can hear you. Great. Yeah, we get. It's the first time. It was our first time going live, so we want to make sure that people can hear us okay in here. We got to make some adjustments as we go. But if you don't have any more questions, again, leave more questions here in comments. We might go live again down the road. We'll schedule it to help anybody out with any other phlebotomy questions. We can go from there. Let me see here. When you're drawing a sample and a patient begins to pass. Okay, what do you do when you're drawing a sample and a patient begins to pass out? Great question. So let me start with this because that's a great question. The first thing you need to ask your patient before you even draw on them is if they ever had any complications during a blood draw. Do they have any complications? In other words, have they ever passed out? Do they get lightheaded? Do they get nauseous? You need to ask that question right off the bat. That way, if they tell you yes, yeah, I get lightheaded and sometimes I might have passed out or almost, then you need to put them in a supine position, laying down, more of an incline. They usually have those in the hospitals and the labs where they can draw from an angle on their arm. If they don't have any problems and they say no, I never had any issues, I always have, then you can sit them in a Fowler position. We call it a Fowler, where it's like sitting up like I am, and they can draw right across from them. If they start to get lightheaded, the first thing, if they're sitting in the upright position like I am, the Fowler position, then you want them to put their head down, or head down with their arm, get a cold compress, put it in the back of their head, and of course, make sure they're okay. Now, and then of course, get more. If you're in a hospital, you want to grab the nurses or anybody else to kind of help you if they're passing out while lying in bed. Get a nurse to help you. If these are the signs you look for, okay, when you're drawing a patient, okay, you need to look for their signs of if they start to get pale, they start to get a little more whiter. If they start to sweat, If they're in a stare gaze, like looking right through you, they're not. If you're talking to them and they're not listening to you, that's an indication that they might be starting to pass out. All right. Sometimes they might even say, "I smell something funny." Okay, believe it or not, these are the things you look for while you're drawing blood. So if I'm drawing on a patient and I'm talking to them, I'm looking at them. I say, "Are you doing okay? Are you doing okay?" I'm looking for them to start sweating, turning pale. If they're not engaging with me in conversation and they're just kind of staring blankly, or if they're saying, "I smell something weird in here," these are clues that they're probably getting ready to pass out. And that's when you got to stop what you're doing, take the needle out, cover the patch, and have them put their head down and rest and so forth. So again, first you ask them the questions if they had any complications so you know how to sit them. And then while you're drawing the blood, engage with them, talk to them, and look for those signs. Okay. Then you'll know those are the things you want to look for. How many times are you allowed to attempt drawing blood from a person, but can't get any? Okay, so you're only allowed 2 attempts. Okay, 2 attempts. That's it. You can draw one on each arm, 2 on one arm. After that, you're not allowed to draw anymore. That's the standard across the board with any hospital lab. You're technically allowed 2 attempts. Anything more than that can be looked at as a violation of the standard of care, and you could be held responsible for that. So if you can't get it by the second stick, you need to get another phlebotomist in there, someone who can locate the vein. So technically, you're only allowed 2 attempts according to the CLS standard. All right. So keep that in mind. People want to draw 3 or 4 or 5 times. Okay, well, again, you could be held liable for violating the standard of care. And if something does happen to the patient, they might ask you how many attempts did you make. And if you say, "Well, I drew 4 times, 5 times," well, you're only allowed twice. So if there's any legal action that needs to be taken place, that will be held against you that you went above the standard of care of 2 draw attempts. Okay. Um, let's see. That was with Jazz's. How do you calm a patient down if they don't like needles? Luna, great question. Uh, Again, I made a video on this for difficult draws on how to deal with patients. You need to talk to the patient, answer any of their questions they might have about the blood draw, give them assurances. One thing you don't ever tell a patient or don't ever tell a child specifically is that you won't feel a thing. Okay. Because that's not true. You want to tell them you'll just feel a slight pinch, a slight pinch. That's typically what you're going to feel in the blood draw. But don't ever tell a patient or a child you're not going to feel anything. Now you might get patients that tell you, "Well, I didn't feel anything." Well, that's great, but most of the time they're going to feel a slight pinch. All right, to them that's really nothing. So it's like, "Oh, I didn't really feel anything." And they felt that the slight pinch, but it was nothing to them. But don't ever tell a patient you're not going to feel a thing. You need to talk to the patient. Try to stay at a. Do not hang over a patient, like look down on a patient while you're talking to them, because that's kind of a superiority complex. Try to be more of an eye to eye, or if you're with a child, squat down at their level and talk to them. Um, Give them reassurances of what the doctor has ordered, what you're going to be doing, and just try and ease them. They can look away if they want to, or have someone hold their hand. But the most important thing is let them know you're going to feel a slight pinch. Sometimes they even pinch their hand and say, "This is what you're going to feel. Did you feel that?" And they go, "Yeah, I felt that. Did it hurt?" They go, "No, that's pretty much all you're going to feel." So if you let them feel it first, I usually I'll pinch a patient's arm and say, "Do you feel that? Does that hurt really bad?" And they'll be like, "No, that's what you're going to feel. It's a slight pinch of the needle." So you really have to talk to patients, and everyone has a different method of doing it, but that's how you want to do it. So Luna, that's one way of doing it. Trying to get them. Yeah, Emmanuel says it's been to me twice. It happened to me twice. It happens when I miss the vein and try to enter again. And with both of them, we had a great conversation. Yeah. Um, you might miss veins, and as long as like I said, you got 2 attempts. Again, talking to the patient, try to reassure the patient. A patient's that's the whole part of the job, is communicating with your patients. And Luna, you're welcome. I'm glad that helped. So Your whole job as a phlebotomist is important where you got to be able to have great communication skills, handling of patients of any age. That's very, very important. Being able to, assure the patients of their fears and helping them. And a lot of phlebotomists who've done it for so long, they're more robotic. They go in and out, in and out. They don't really engage the patient. They go in there, do their thing. They hello, hi, thank you, we got to do this, and a lot of times a lot of them are really rude. And I think if you don't like your job, I like being there, then you probably shouldn't be working in that field. All right. Yes, people have bad days and all that, but overall, you should be, look at your job as you're handling patients, who need blood work for diagnosis, whether it's for surgeries or for medications. And that's serious stuff. Again, this is your mother or your grandmother or your child. You want the best care for that person, and you want them to be able to draw on your child, your mother, your grandmother, and do the job right. So they don't have to come back again because the phlebotomist didn't draw properly. All right. So that's very important. All right. You need to enjoy your job because patients' lives a lot of times are in your hands on how you handle the specimen. If you handle it improperly and you don't handle it correctly, that specimen can get rejected and the patient has to come back again. And anything they have with medications and surgeries get delayed. And that delay could cost a patient's life. And most phlebotomists don't really think about that or consider that. So your job is very important. 70 to 75% of all diagnoses come from phlebotomy, from the blood, and from you doing your job properly. If you don't have phlebotomists in a lab in a hospital, the lab has to shut down, the hospital shuts down. Phlebotomists are essential to keeping the lab open and the hospital open. Without phlebotomists, there's no lab. Without a lab, the hospital shuts down and starts to transport patients out. You have to have a phlebotomist and you have to have a lab. So you are essential to the medical field. You're essential to the hospital staying open and dealing with patients as they come in. Without the phlebotomist, the lab does not operate. As far as being able to draw blood, which is what all the phlebotomists do in the hospitals and labs. So you've got to keep that in mind that you are important and you're essential to keeping the hospitals open, and the labs definitely need you. All right. All right. I don't know how long we've been on here. Almost a good 40 minutes. Well, listen, if I don't have any more questions here in the chat room, I want to thank everybody for participating, coming in here and watching. Again, if you're not a member, I encourage everybody, if you can become a member. It is $2.99 for the lowest one. If you become a member, you have access immediately to our phlebotomy student page that we have online that you can log into and watch all our videos in order from week 1, week 2 that our own students go through. You have skill videos on there. You have state videos on there that's not on my channel. You have practice exams. You have our books that you can download on there. Our textbook is downloadable. All that stuff for the $2.99 and up as a member. So if you could become a member, please become a member. It helps our channel grow. We can put more content out here. I can make more time to come on here and answer more questions for you guys. But consider becoming a member. It does help. And keep subscribing, sharing, liking, post your comments here. And I appreciate everything you guys do on here. If you go to our channel and click on join, that does put you into the member category, and you can actually go to our official YouTube page and look at members only, where you can access the link to our student page to get access to all of our videos and books online for free. And the minimum is $2.99. So if you guys can do that a month, $3 a month roughly. If you do anything higher, that'd be great, but that's the minimum. We appreciate it. I appreciate it. And I'll be able to make more videos, come on here more live, make more time. Again, this is for you guys, so you guys can get more teachable content out there with phlebotomy, get your questions answered, how instructors should be teaching and all that. So again, I want to thank everybody for tuning in. Again, if you like, subscribe, share, leave a comment, I appreciate it. And again, we'll see you again soon on our next live channel. And see you guys soon.